Hi there and welcome to Fracture Friday. Today is a special episode of You Play the Doctor, okay? This patient is an emergency visit. She comes in and the phone call ahead of time is, I cut my toe and it won't stop bleeding. Now, first thing you're gonna do is, well, one, tetanus status, okay? Hopefully you said that and make sure that's fully updated. Next, you might say, clean the wound? Well, how about we start with some x-rays? You might say, well, it's just a cut on the toe. We ask a few more questions and it was a 100-pound door fell on her toe. Now, do you want to see some x-rays? All right, looking in closely, you can see fracture line here, fracture line here, and a larger fracture line with a little separation right through here. Now, this is the joint space and the fracture line does enter the joint space. However, this remains with parallel lines, so anatomic alignment is maintained, surprisingly, but this is a significant comminuted fracture of the distal phalanx of the big toe or the hallux. Okay, so tetanus updated, you got your x-ray, comminuted fracture, laceration, so it's technically an open wound with a fracture, high risk of infection, or infection could even travel to bone, so absolutely going to put the patient on antibiotics. She's in too much pain to do anything other than numb up the toe, so we do that with some lidocaine, numb up the toe, and clean out the wound extensively, flush it out. Now this was within an hour of the injury, so we can actually close the wound with sutures after cleaning, flushing it out real well. One little take-home message is, well, it didn't look real swollen and black and blue, as a comminuted fracture might look. Like, hey, why isn't the toe big and purple? Well, the cut let the blood come out. So the fracture bleeding was coming out of the toe. You didn't have a big purple swollen toe. So initial look may not have been fracture looking, but that's why we are very thorough with all of these types of injuries, as the patient may be only focused on the cut and the bleeding and lead you astray. You have a fabulous day.